Okay, guys, not sure where my picture is, but we're going to go through this PowerPoint nonetheless. This is chapter 4, starting out. We're going to start with medical terminology. Very brief, very basic. I'm not going to get too deep into this. Basically, what we're looking at is we're taking words, okay, and breaking them down phonetically or by parts to understand what they mean. So, cardiologist, most of you guys might know what this actually means. It's specializing or studying the heart. And so, if we look at this correctly, cardio stands for the heart, ology stands for study of, and ist is one who specializes in. So we have a cardiologist, someone who specializes in studying the heart. Basically, our medical terms are broken down into 3 parts. We have the word root. In this case, with cardiologist, cardio is the word root. It's referring to the heart. A prefix, which didn't exist in that first word, but a suffix, which was ologist, is the end of the word. So it's basically English is what we're looking at here, basic English kind of writing. And here's some more examples of that stuff. So cardio root would be heart, neuro root would be nerve, naso root would be nose or nasal, oro root would be mouth or oral. Here's some prefixes: hyper, hypo, tachy, and Brady, and they give you examples of what they mean: above, below normal, above or below normal for tachy and Brady as well. Different ways that we can use these. And then we look at suffixes: AC, ology, al, or ist. And that is pertaining to, study of, pertaining to, and who, one who specializes in. So it's a real simple way of understanding how medical terminology works. And reality is, the more time you spend in this, the more you'll learn. It just takes some time going through this stuff to kind of break it all down and understand it. But if we understand the basics, we can start to break words down and have an understanding of what we're dealing with. So let's go on anatomical terms. Okay, you guys will be looking at this diagram here, and you will actually have, a diagram you'll be, going over specifically from what you see here. Anatomical position is what you see here. This is the position we refer to any and all patients when we're dealing with. If you've got a guy who's on the ground and leg is twisted up behind his back and missing an arm, when I'm talking to any healthcare professional, I am referencing that person in this position you see here, the anatomical position, not the twisted mess on the floor. Okay. We're looking at right and left sides. We're looking at, we got the head, torso, and lower extremities. We take chunks of the body. Upper extremities and lower extremities are completely 2 different things, obviously. If we take the head and we break it into the cranium and face, major structures there, the mandible. Okay, now the neck is on its own. Structures in the upper, we have the shoulders, arm, elbow, forearm, wrist, and hands. And then lower, we have the thigh, knee, leg, ankle, and foot. And we also can refer to chunks of the body as the thorax, which is the chest, the abdomen, which is the stomach, the abdomen, and the pelvis. Anatomical positions of the body. When we find a patient lying on their back, they're referred to as supine. When we find a patient laying on their belly, we find them in prone position. Body position, right lateral recumbent. This person is obviously, as you can see, laying on their right side. And left lateral recumbent for anatomical position. And I'll let you know right now, when we talk about putting a patient on left lateral or recumbent, okay, typically we want to have the left side because that aids in breathing and also prevents aspiration technically. And I'll explain that as we get into anatomy a little bit more. But technically, this protects the patient from aspiration, which is inhaling fluids into their lungs, okay? Vomiting and getting that fluid back in their lungs. By being on the left side, there's less of a chance that's going to happen. Directional terms. As we start looking at these terms, we've got to understand direction of some things, right? We have medial and lateral. Now, medial is going to be toward the medial or midline, okay, of the body. So there's midline right there. And medial means it's coming to the middle. Lateral means it's going away from the midline. It's coming away from that, okay? So we have the midline down the center, and we refer to anything that is coming close to, it's medial. Anything that is away from, it's lateral. Directional terms here one more time: superior and inferior. We have superior being towards the head, inferior being towards the feet. We have the mid-axillary line where we actually divide this body in half this direction. And anywhere from this point up is considered superior, okay? Anything this direction and down refers to inferior. Now, a simple way to remember this is your feet are inferior to your head, right? So inferior below, superior is high. It's more important, correct? Distal and proximal. This one is hard, okay? Distal means away from the core of the body, the trunk of the body, away from anatomical structures. Proximal means closer to, okay? So this is hard to kind of explain when you talk about terms as far as identifying parts of the body. But if I had an injury right here, okay, right here on the forearm, basically what I'm looking at is I'm looking at a injury that is distal from the elbow. You guys see that? Here's the elbow. Distal from the elbow, proximal to the wrist. Okay. So when I'm talking to somebody on the phone, I'm discussing something, with my receiving facility that I'm giving information to. They need to paint a picture. We need to paint a picture. They need to see it. And so we're looking at anatomical position, and we're making sure that we explain exactly where that injury is going to be located. It's on the right forearm. It is distal from the elbow, proximal to the wrist. Okay, so it's kind of a hokey way of explaining it, but that's how it works. You can see how distal from and proximal to actually work. It locates it actually. So if the injury was up here, we could say it's proximal to the elbow, distal to the wrist, right? And anterior, posterior, or ventral and dorsal. Anterior is the front, okay, ventral portion of the body. Just two different terms to refer to the front portion of the body when we take that transverse line down the center. Transverse line also gives us the posterior or dorsal. And so here's a simple way to remember this. Think about a shark, right, or any kind of fish. On their back, they have a dorsal fin, right? They have a dorsal fin. So obviously dorsal, posterior dorsal is going to be the back, and anterior or ventral is the front. Just making sure you know where one belongs and the other doesn't fit. Directional terms, take a look at that, guys. Okay, so this does get kind of graphic from time to time. And so what we're looking at here is we're looking at superficial and deep, okay? These types of injuries we have to identify as to what exactly is going on and what are we looking at. In this respect, we have a deep tissue injury, right? This is pretty big laceration cut deep into the hand. Obviously, we're missing finger altogether, so we're looking at amputation. This is not superficial. Superficial is a scratch, a small cut on the outside edge of the body. This is a deep type injury. Internal and external. Okay, internal and external is a very simple term. I think we all can understand this. Any injuries that are internal or inside the body we physically can't see or treat. There may be some bruising that kind of identifies, or tenderness that identifies injury inside. External is what we were just looking at. That's an external injury. Okay, so that is our lesson for today. There are going to be a couple of questions for you guys to answer, and you should have taken notes that was attached to this as you went through this. That is what we got for the day. Thank you very much for your time. Talk with you guys later.